In Lesson 4 of our free online course, Primary Healthcare and Community Nursing, we will make a comprehensive analysis about understanding social determinants of health. Social determinants of health (SDOH) are the non-medical factors that profoundly shape health outcomes and drive health inequities. Addressing SDOH through multi-sectoral action and equity-focused policies is essential for improving population health and achieving health equity. 1. What are social determinants of health? SDOH definition. The World Health Organization, who defines SDOH as the conditions in which people are born, grow, live, work, and age, and people's access to power, money, and resources. The 500 and Healthy People 2030 describes SDOH as the non-medical factors and environments where people live, learn, work, play, worship, and age that affect health, functioning, and quality of life. Why SDOH matter? SDOH are powerful drivers of health outcomes and health inequities. They explain much of the variation in health and life expectancy within and between populations. Major conceptual frameworks for social determinants of health (SDOH) provide insights into how social, economic, and environmental factors shape health outcomes. The WHO conceptual framework divides SDOH into structural determinants, such as socioeconomic and political contexts, e.g., governance, policies, and social classes, and intermediary determinants, including material circumstances, housing, neighborhood, psychosocial factors, stress, social support, and access to healthcare. The Dahlgren-Whitehead rainbow model visualizes health determinants as concentric layers, from individual factors like age and genetics to broader socioeconomic and environmental conditions. Other models include the social-ecological model, which examines interactions across individual, community, and societal levels, and the Frieden framework, a 5-tier pyramid emphasizing SDOH interventions for maximum impact. The life course approach highlights how exposures across a person's lifespan influence health outcomes. In Section 3, we will talk about the 5 major SDOH domains. Social determinants of health (SDOH) are the non-medical factors that influence health outcomes and contribute to health inequities. To better understand and address these determinants, they are categorized into 5 key domains. Each domain highlights specific aspects of social, economic, and environmental conditions that shape the health and well-being of individuals and communities. By focusing on these domains, stakeholders can identify actionable strategies to improve health outcomes, reduce disparities, and promote health equity. The following section provides an overview of the 5 major SDOH domains and their critical components, illustrating how they impact population health at various levels. Economic stability is a critical social determinant of health, as income, employment, and housing directly impact health outcomes. In the U.S., 1 in 10 people live in poverty, with higher rates among racial and ethnic minorities. Unemployment increases the risk of illness and premature death, while food insecurity is linked to chronic diseases and poor mental health. Housing instability contributes to conditions like high blood pressure and respiratory issues. For example, in New York City, 17% of residents live in poverty, 33% of renters face severe rent burdens, and 10% experience food insecurity. Addressing these disparities is essential to improving health equity. Education access and quality are vital for health. Higher education leads to better health, lower chronic disease rates, and longer life expectancy, with a 15-year gap between the least and most educated. Early programs like Head Start improve outcomes, but disparities persist, impacting Black, Latino, and IN students. Healthcare access and quality remain critical challenges. About 8% of Americans are uninsured, with higher rates among Hispanic 25% and AN adults 25%. Rural residents face limited providers, and minorities experience significant care disparities, with Black populations receiving worse care for 43% of quality measures. Neighborhood and built environments shape health outcomes. Low-income and minority communities face higher air-water pollution, limited green spaces, substandard housing, and food deserts, increasing risks of asthma, 395 obesity, and diabetes. High crime in these areas also worsens mental health and reduces physical activity. Social and community context shapes health through support, participation, and systemic challenges. Social support protects health, while isolation raises disease and mortality risks. Discrimination and racism contribute to infant mortality and hypertension. Incarceration disrupts networks and worsens health. Minorities, older adults, and single-parent households face higher risks of isolation, food, and housing insecurity. SDOH economic, educational, environmental, and social factors drive health inequities. Tackling them requires bold, equity-focused action. Prioritize multi-sectoral policies. B. Target marginalized communities first. C. Integrate SDOH screening in healthcare. What policies can reduce SDOH disparities across all domains?